Hello, my name is Haley Matson, and this is my BSN Educated Citizen portfolio. So just a little bit of background about my public issue. I decided to do juvenile diabetes research and other things like that. A lot of in the media, what you hear with education and awareness is type 2 diabetes. So I feel like this is a huge issue just because there's not as much education about type 1 diabetes. Roughly over 64,000 individuals are diagnosed each year with type 1 diabetes. Thus, there is a need for education and awareness. What my project and public health issue goes over is awareness, education, and cost and funding. As we know, diabetes is a very expensive chronic issue, and fortunately, insurance is out there, but not everybody and individuals are able to obtain insurance, thus creating more issues with affordability. A lot of what my project and my public issue goes over is cost and affordability, that capping of insulins, to be exact, to kind of help with that. And as far as affordability goes, I know Nebraska is not one of those states quite yet that makes it as low as some, but there is a cap, I believe, and it's around $50 to $100 if I'm correct. So capping has helped tremendously with many. And then just generalized type 1 versus type 2 diabetes. While both are very prevalent, type 1 diabetes is a little less prevalent, thus not as much exposure. And a lot of what my issue goes over is more education and awareness for type 1 diabetes. The only difference between both of them is type 1 diabetes is insulin regimened, meaning they have their whole life, they basically will be on a system of insulin, whether that's injecting themselves or through pump systems and things like that. Whereas type 2 diabetes can be controlled through diet and exercise and lifestyle changes. So that's kind of the difference. A reason why I chose this specific issue is because when I was 12, I was diagnosed with type 1 diabetes, and it was a whirlwind of emotions, not for myself, but for my family as well. And so I have a huge passion for this, and I hopefully within the future, I'll be able to do research as well. So basically, an effective communicator is someone who uses critical thinking to generate, connect, and organize ideas in a written and oral and nonverbal way. So for my first effective communicator entry, I decided to choose my community project. This project was something that I did my freshman year in my sign language course. Through Nebraska Methodist College, we're required to take these classes, but I've always had a very big interest in signing. This community project, we were able to go out in the community and get more involved with the hearing impaired and deaf community. I decided to go to a local church that hosted a hearing impairment group once a month. And there I was able to try to use the skills that I have learned over the course. And it was something that was very, very beneficial and very experimental. Something that I've learned is that being an effective communicator is a lot more than just using your voice. It's basically immersing yourself into that culture, that language. In this case, it's signing, and doing it without feeling like you're going to have some sort of regret or nerves or angst, because most likely they're more than willing and welcoming. And in this case, they were very welcoming and really, really enjoyed the fact that I was very much trying to incorporate and immerse myself into something that was very nerve-wracking for myself. So I guess the way that I can apply this is that type 1 diabetes is something very complex and very hard to understand. And so just like how I was scared to learn this language, think about all the newly diagnosed type 1 diabetics. They're scared, they're nervous, there just is so much going on. And if we add a language barrier into that, that can kind of cause some concern. So using things such as Marty's translators or face-to-face interpreters can really help basically lessen this effect. And this goes for, any language barrier. So my next effective communicator is Methodist Hospital. This was also my freshman year. I was able to take care of a patient that was life flighted from out of the country into Methodist Hospital, where this patient was unfortunately injured and became a quadriplegic and had to be on a ventilator. And basically, I created a tool. This patient was incredibly scared, very just overwhelmed, and had a lot of angst. And something as simple as finding a tool really, really helped him, and really honestly just created a huge communication thing for us. What I learned is that communications is extremely important, not just within the hospital, but just in general. And that without communication and collaboration, a lot of things don't get done and things won't get done properly. Thus, the application. Because how I kind of connected these two is that my collaboration is used for everything. Just like this patient had a lot of collaborating between staff and providers. There was a huge interdisciplinary team because of the chronic illness. Now tie this into diabetes. Juvenile diabetes is a very chronic, complex illness that requires multiple people outside of just a primary care provider. This includes diabetes education, endocrinology, maybe it's nutritionists, dietitians, whoever it may be. There's a huge team that we rely on in order to make things happen. Next is reflective individual. Basically, this is an individual who routinely engages in habits of inquiry that influences the way of thinking and actions. So, from one of my reflective individuals, I did a research project. Now, this research project was done, and really, I wanted to research more on antidepressant therapy and suicidal ideation. Were these correlated? Was this the first line therapy and treatment? What I learned is that we should not be judging a book by its cover. Just because one individualized therapy worked for some doesn't mean it's going to work for everybody. That's why individualized therapy is something that we have to go on based off patients. So applications, after the research I did with my public issue, I noticed that people who were diagnosed with juvenile diabetes or type 1 diabetes were at higher risk for suicidal ideation and suicide. And so addressing these concerns with mental health is a huge thing. Again, this kind of can go back to collaboration, interdisciplinary teams. If a patient comes in with mental health issues prior, that would be something that we should be on top of, as diabetes is a very stress and high strung illness, and ensuring that we're addressing those issues before it becomes one. The next reflective individual I did was the VA. I was at the VA where I was assigned a PTSD Vietnam vet. And basically this patient wanted nothing to do with anybody. He didn't trust anybody. He never built rapport with anybody. And so I knew my goal for the day was to basically get this patient to talk to me, to agree to his high alert medications, such as in this case, insulin, and his other medications such as Lovenox. And so I ended up being able to find out what his favorite drink and snack was from home. And so I went down to the gift shop and I bought these. And just based off that little gesture, he ended up realizing how I took it upon myself to make sure that he felt comfortable in a very vulnerable state. So what I learned is that critical thinking skills are used on multiple levels, meaning it's not just medication based. We need to think outside the box. Building rapport and trust with these patients are our biggest concern. And then after building this rapport and trust, these are how patients will comply with different things, such as in this case, assessments and medication. And we can apply this. There's always going to be roadblocks and disconnection with patients. Type 1 diabetes is a huge issue. I know when I was a teen, I was very rebellious and I had a lot of roadblocks and disconnection with a lot of the time when people were trying to explain stuff to me. And I've noticed that throughout my clinical experience, a lot of these roadblocks happened with other diabetic patients, meaning The VA experience that I had, this person didn't trust me. So with my issue is this is very chronic illness. We need to build rapport with these patients. We need to build trust with these patients. We need to make sure that they're educated and not scared or vulnerable. And then change agent that I had is Methodist Physicians Clinic. This happened as a senior last semester. My experience was basically I was in a shadowing a health coach where a lot of their primary is chronic illness and that older adult crowd that are maybe discharging from a hospital and making sure that they're following up with their providers. However, a lot of that population is a diabetic population. With this patient, we noticed that this patient called in and had some concerns about her insulin management. This patient had a home health nurse that would come in every day and give her medications and other, and help her with other things such as her ADLs and things like that. She had some questions about her insulin management, and come to find out, she was actually given the wrong amounts of insulin. Per the recommended dose, it was 30 units, however, of long-acting insulin. However, the nurse was only giving 8 units of long-acting insulin and 8 units of her normal fast-acting, thus creating high blood sugars. Once I figured this out, and with my knowledge, I was able to bring this up to the health coach, and we were able to set that patient up and the nurse that usually takes care of her with a face-in-face in person with her PCP, as well as set up an appointment with the diabetic educator to make sure everyone's on the same basis. What I learned is that advocacy for patients is huge. If this patient never actually reached out to us or we never reached out to them, we wouldn't be able to get to this place where we were able to do this. There could be some negative outcomes such as, hospitalizations and things like that. Vocalizing concerns and identifying the problem. So we want to make sure that we're vocal when it comes to these concerns. We don't want to obviously hurt the patient, but if the patient's put in a situation where ultimately the outcome could be negative, we want to make sure we're advocating that and identifying those risk factors. Basically, how I applied this to my issue is that advocacy and awareness is huge with my issue. Like I said in the beginning, is that type 1 diabetes tends to get overlooked when it comes to generalized education, meaning a lot of that population who's newly diagnosed has never even heard what type 1 diabetes is, but rather just the name. So making sure that we advocate and create awareness for type 1 diabetes just as much as we do type 2 diabetes. Even though it's an autoimmune illness and it's usually genetically marked in our DNA, is still important, and especially for people who have other type 1 diabetics in their family, we want to give them screening opportunities and prevention tools, thus advocacy and awareness. And then my other change agent is just a prior CNA experience I had while being in Nurse 100. So the experience was we had very unfair, unorganized, and unsafe workloads, meaning we were taking about 30 patients per CNA with unheard of amount of responsibilities. When I brought this up to management, I was very timid, very scared to bring anything up to her, and I realized that the work that we were doing was very unequal, unfair, and definitely not safe for patients. What I learned is that we need to be more vocal, especially with us becoming future nurses. Advocacy is something that I've talked about throughout my whole presentation. But being vocal, being less timid when it comes to authority, and bringing it up in a way that is very respectful, but also allows them to understand what is going on. Basically, how I applied this to my public issue is that vocalizing awareness and advocacy for type 1 diabetes is something that is huge. I hope to, in the upcoming years, that they become more vocal and spread to more of the population so that more people are able to get screening and prevention and other things like that. While type 1 diabetes isn't preventable, there still are ways to get tested. And that's something that's huge. So I've always been very vocal. I've always been very passionate. And I believe that with a little bit of vocalizing concern, we can go a long way. So basically, in conclusion, I believe that I had the essential building blocks to become a developed, effective communicator, reflective individual, and change agent. Because of NNC, I was able to get these building blocks and was able to achieve this um, throughout over the last 4 years. And I hope that I can take what I've learned here at Nebraska Methodist College and apply it to my career as a future nurse. And with me being a type 1 diabetic, I've always will have a passion for this. And since I am going into diabetes education, this project is not something that will just be done in school, but I will actually make a change within my future career. And I believe Nebraska Methodist College helped me do this. Thank you.